Hi, I'm Dr. Jeff Poole. I'm with Utah Digestive Health at Tanner Clinic. I'd like to talk to you about your colonoscopy prep. Lots of people are scared or apprehensive about doing their colonoscopy prep, but it's pretty simple when you start doing it. The main thing is to take the whole prep. A lot of people think that just a little bit of prep and they haven't eaten for a while is good enough, but really taking the full prep is the most important thing. The better the prep, the better the outcome of the colonoscopy, the easier it is for us to do the colonoscopy and to see what we need to see. As a general rule, we use the prescription bowel preps. These have been shown to work very well. It's really dependent on your insurance, which prep is best covered. They all work well. The most important thing is to take it. There are a couple medications that we worry about when you're undergoing colonoscopy. We worry about blood thinners. Blood thinners obviously are important for multiple cardiac issues or blood clotting. We'd like to hold those if possible before you undergo a colonoscopy. Sometimes that's not possible, and that's something that needs to be discussed with your physician. Recently, with the use of GLP-1s or these weight loss medications, it makes your stomach not empty very well and increases the risk of aspiration. Usually with colonoscopy, it's not a concern because the bowel prep cleans everything out, but it is something to discuss with your doctor. When you're taking a colonoscopy prep, it does give you bad diarrhea. That's what we're hoping for, and that can dehydrate you. What we recommend is definitely the day of the prep. During the day, we have you on only a clear liquid diet. And what we'd encourage is drinking lots of liquids before you start the prep. Get yourself well hydrated so that as you start having the diarrhea, you don't get in a condition where your body's trying to retain fluid and water to prevent dehydration. What works for the average person doesn't work well for someone who already is suffering from constipation. We can counteract this constipation by taking laxatives for several days before or taking extra prep so that you do get a good bowel clean out. We also recommend limiting the amount of fiber that you take for several days before your colonoscopy. Fiber is just undigestible material, and if you put a bunch of fiber in your colon right before you start a bowel prep, that all has to come out, and that makes it more difficult. Some people do get nauseated with taking the bowel prep. If this happens, you can take an over-the-counter nausea medication, or most of the time just slowing down, not drinking it quite as fast, or taking an hour off and just letting things settle for a little bit will take care of that nausea that you have during the bowel prep. Choosing to have a colonoscopy is one of the best decisions you can make, but colonoscopy is really the only modality that prevents you from getting colon cancer. We try and make getting your screening colonoscopy very convenient. If you give us a call, we can get you set up for a colonoscopy, or you can talk with your primary care doctor. We're happy to help you out with this, and we feel it's very important to get the screening to prevent you from getting colon cancer.